At the Health and Social Care Alliance Scotland, keeping people at the centre is at the heart of everything that we do. Over the last couple of years at Person Centre Voices, we've been travelling across Scotland, hosting talks and workshops, meeting thousands of health and social care professionals along the way. In this short film, as part of our Humans of Scotland series, Nursing and Midwifery and Stories, we'd like you to introduce you to some of the remarkable people we have met along the way who do the most incredible things to help keep us safe.
So I was inspired to join midwifery as a career due to the care I received in my pregnancies from the midwives, especially care I received after the loss of my son. So I wanted to be that person for women going through their pregnancies, because pregnancy is a happy time for most, but it's also a vulnerable time and a scary time.
Almost fell into it, having not, between jobs, and there was an advert, so I applied to become a healthcare support worker, and whilst I was doing that, I thoroughly enjoyed it and decided to do my training, and I've never looked back. That was for me. It was that initial experience being in a healthcare support worker, working with a team, and then working with patients in really vulnerable position, and seeing the benefit that we can make on a day-to-day basis.
Just to try and make a difference to a child who was having mental health problems, to introduce therapies, coping strategies, and to help them deal with those difficulties.
What inspired me was I cared for a lady who was admitted to hospital when I was a carer, and I stayed with her through that time, and I saw how dedicated and hardworking the nurses were there, and the compassion that they showed myself and the person I was caring for.
I started my training at 32. I worked in the hospitality business sector. I'd always fancied doing something a bit different in my career, helping people, making a difference to people's lives, and that's what inspired me to become a nurse and start my training at a later age at 32.
I've actually always been drawn to healthcare profession because I'm surrounded by them, and most importantly, I went into School of Nursing on the account of my mother, not because she believed that I'm going to be a good nurse. She knows that I was going to be a great nurse, and that was what she told me, and she's absolutely right. I have no regret.
It's always been working with people who've got significant trauma and in really vulnerable positions, and building up that trusting relationship with patients to be able to support them to take those next steps.
I took her in and brought her into labour ward, got her settled, and kind of carefully read through her birth plan, and I really managed to meet all her birth preferences, and thankfully nature helped us out and everything went really well, and we didn't need to intervene or anything, and she had the most beautiful birth experience that she wanted, and it's exactly what she'd hoped for with her first baby. And she said to me after that it had healed a lot in her from her last time, and that day just reminded me that, this is what I do, this is why I do it. I do it to advocate for women and care for women, and make them feel like they're the most important person in that situation, and it's their birth, it's their body, and it's their baby.
I was there at a time when they really required that support. They lived very rural, and it was all very tense for the family, and the patient was very apprehensive, and I managed to use my interpersonal skills with the family, and just really being a real support, and I think they really appreciated that.
A career highlight for me would be getting into the endorsed route to nursing, which has enabled me to go into the second year of uni, and I've only then had 2 years at uni, and I'll be qualified in September.
Getting my job in the first place, I'm newly qualified, so having a job and being out there working has been so good. A good day for me is I'm in the community, so I love an antenatal clinic. I love meeting people when they're pregnant.
What makes a good day for me is when I'm able to address and listen to my services and my patient in collaboration with my colleagues to deliver high quality care. For me, that is a good day.
The thing that inspires me to keep going as a midwife is it is the best job in the world. There's nothing, personally, I think, more amazing than bringing life into the world and helping women give birth to these amazing little people that are going to be, men and women themselves in the future.
My advice for someone considering starting into a nursing career is to go for it. The opportunities are amazing. You can be promoted, you can sidestep There's so many things that you can do in nursing, it's endless.
I think we definitely need more nurses, and it's a fantastic profession. I can honestly say from the bottom of my heart that it's the most rewarding job that you can have, and you can truly make a difference and learn so much doing the job.
If you've not had any experience in a healthcare settings, just do it from the beginning. And just go step by step, just take it easy.
I think what I would say to people, even those that are maybe not thinking about a career in nursing, is, I don't know how many roles and jobs you can do in the life that you make the difference that we do in nursing.
So don't listen to anybody that tells you it's too hard. Don't listen to that career advisor at school telling you you'll never get into it, or you should go and do adult nursing first. If you want to do midwifery, do midwifery.
The most important thing too that I really like in working in NHS and as a nurse, I have opportunity to look at health inequalities. I have opportunity to contribute our learning from COVID to make sure that we support our service user and everybody's welcome in NHS, irrespective of your skin color, your gender, your class, your socio-economic. We welcome everyone, and I want people to know that. Come and join us. You will not regret.
A big thank you to the incredible nurses and midwives who have shared their stories with us as part of our Humans of Scotland series, and a massive thank you to you for taking the time to watch this short film. To learn more about the Health and Social Care Alliance Scotland, person-centred voices on nursing and midwifery, there'll be lots of information on the slide at the end of this short film.